hello everyone. Very happy to be here today presenting some of the results of my PhD studies that I've done in Quebec about predicting heat-related mortality and morbidity using machine and deep learning methods. So I'm going to start first by acknowledging that most of these work have been done in Quebec City, which is located on the unceded traditional land of the Innu, Huron-Wendat, and Abenaki First Nation. And also here we're gathered in Vancouver, which is the original land of the Musqueam, Squamish, and Tsleil-Waututh First Nation. So the outline for today, I'm going to give you a little bit of context about heat and health relationships. Then we're going to have a small introduction about machine learning models, because I probably know that most of you aren't that much familiar with machine learning, so it's not going to be a classic lecture, but still it's going to be a small crash course. And then we're going to show 3 different applications of using machine learning to predict heat-related mortality and morbidity. The first one is going to be on the model. The second application is going to be with a focus on the variables. And then the third application is going to have a focus on modeling mortality and morbidity in multiple regions simultaneously. And then we're going to conclude with the key messages of this presentation. So, the context. So we all know that extreme heat is affecting population health. We started realizing that back in 2003 with this extreme heat wave in Europe with 7,000 deaths and 15,000 only in France. In Canada, though we are a northern country, we think like maybe heat don't affect us, but in Quebec only, there were 2 major heat waves in 2010, 2018, 280 deaths and 3,400 excess ED visits in 2010. And then even though a lot of measures were put in place, still 210 deaths in excess in 2018. And then you're all aware of the 2021 heat dome in British Columbia with a death toll of 700 deaths, which is the weather event with the most fatalities in the history of Canada. So a lot of these regions have put a lot of measures in place following these extreme heat events, mostly heat alert thresholds. And I'm going to start with a small question for the audience. So we're right now in Vancouver. We know it's not summer anymore, but still, when it's summer season, Vancouver will issue some heat alert. And I'm curious if you know when these alerts will be issued. So is it 3 days of daily maximum temperature above 30? And night temperature above 18? Is it 2 days of maximum temperature of 29 and night temperature of 16? 1 day of a humidex of 40 or higher? Or maybe I missed one. Yeah, 2 days of daily maximum temperature above 30 degrees. Right. So here, I don't think like the goal is really like that you remember these thresholds. It's really just to see that, and maybe if we can let that a little bit here, because I don't have the answer on the on these slides, but just to see that there's a lot of way we can define heat. Like we can use the maximum temperature, we can use the nighttime temperature, we can use the humidex, we can use different durations. But then the correct answer was this one, and only 20% of people got it. It's really like 2 days of 29 degrees and a night temperature of 16 degrees. So it's maybe a little bit lower than what you expect. And these are based, of course, on mortality and morbidity data. So I think we're going to stop here, the poll. And what I wanted you to see here is really that we rely on very few temperature values when it comes to modeling heat and health. As we've seen with this very small example, well, the heat thresholds are only based mostly on maximum temperature, which is the daily temperature, and minimum temperature, which is mostly the night temperature. And across all Canada, most of these thresholds are also based on maximum, minimum temperature, or sometimes also humidex. And when it comes to doing some epidemiological models, well, most of these multi-country, multi-cities studies, they all rely only on the mean temperature, which is just the average of maximum and minimum temperature. What we think is that to model the heat effects, we need to consider more than only these temperature variables. Of course, we can think easily of the humidity, which will change how people react to heat, but also air pollution, knowing that there's a lot of synergistic effect between air pollution and extreme heat event. Also, these thresholds or these models that we use, either the epidemiological model or the heat alert, well, they're not really validated or meant to do some prediction. So even though these thresholds are met, we don't really know what's going to be the death toll during these extreme heat events. And we don't really have the models to do some prediction. And that can be problematic when we face a very major heat dome as what we've seen in British Columbia in 2021. So our goal with this project was really to explore machine and deep learning models to include some interaction effect between these different variables, but also to test these models in prediction context to see if we can forecast what's going to happen during extreme heat events. So we're using machine learning models. There's a lot of different advantages why we're doing that. And I want to start by another question about your current knowledge of AI and machine learning. Again, you're not going to be evaluated on that. It's just for me to know what is your current level. And every time I do that presentation, there's nobody that answers high or expert. I don't know why, but I feel people are maybe shy to say it. And I don't consider myself either an expert. So, but yeah, that's the kind of thing I'm expecting, and that's why I'm not gonna go into the mathematical details of these models, of course, but just to give you a very small overview, a very small crash course of what is AI, what is machine learning. So we're gonna end the poll here. And when I ask this question, maybe I think of people thinking they're expert in AI because they will daily use ChatGPT, right? So of course, like it's not the same thing. So I'm more thinking about how to build these models like ChatGPT. So I think of AI and machine learning as this figure. So we have artificial intelligence. It's a very big umbrella term. But inside artificial intelligence, we have machine learning and we have also deep learning. So of course, artificial intelligence is ChatGPT. It's a model that allows us to ask questions and there's no like human intervention. We can think also of personal assistant, automatic car, or even like robots. These are all artificial intelligence systems. But when I think about this project on heat and health, I don't want to develop an automatic system that will take decisions instead of people in public health authorities. What we really want to do is leverage this algorithm or these models that are used in AI and train them with the data that we have to help people do their job. So machine learning models are really like the algorithms that are used inside artificial intelligence, such as models to detect cats on image. And maybe that's not that much useful for health application, but the same models can also be used to detect diseases on medical scans, which is probably more a good use of our resources. We can also use machine learning models to treat some voice signal or also some text signal. A lot of different data sets can be used in machine learning models. And then we have a very small subset of models that are called deep learning models. And these all belong to the family of the neural network model. And when we have neural network model with a lot of hidden layers, we call that deep learning. So it's just one family of models inside the machine learning family. I'm gonna go into the supervised machine learning model, which is the models that I've used for this project. And the goal in supervised machine learning model is really to learn a relationship between some Y variable and some X variable. So in machine learning models, we kind of name things differently. So we call the X variable the inputs or the feature. We have the machine learning model F, and then we call the Y variable the outputs or the label. And then if I bring back to what we know from statistics or environmental epidemiology, it's pretty much the same thing. It's just that we've changed the order and we've changed the name. So we have the response variable or the dependent variable Y. We have a statistical model. We have the exposure or covariables, and then we have an error term. So there's like two main differences here between what we're going to do in supervised machine learning and in statistical model. First one is that the model in statistics, it's a fixed model. So we can think it's a linear effect or a nonlinear effect, but this model, the structure is not going to change. While in machine learning model, we're also learning the model. So we don't really know what's going to be the type of model we're going to end up with. So that's something that is very different because this model can really be more adapted to the data that we have. And the second difference is the error term. That is something very important in statistics and in epidemiology because this allows us to derive, for example, 95% confidence interval. While we don't see that in machine learning, we're not interested in modeling this error. So that's something that we may want to do. So we may want to do some statistical model. But then if we're not interested in this random error, well, we can go and just do some supervised machine learning. So the different models that we've considered here are three family of models. So the tree-based model, they're all based on decision tree. We've included random forest and gradient boosting. We're going to show you what are they in the next slide. We have also neural networks. So as I've mentioned, these are the family of deep learning. So the single layer perceptron, the multi-layer perceptron, and the long short-term memory. And then for most of the people doing machine learning model, they will include also statistical model. But for them, this is also just one class of machine learning model. So I've included a generalized linear model, generalized additive model, distributed line linear model, and also a last one. So here, I really like this figure because it shows all the different machine learning models that exist. And if I think about the model we've used in red, we really try to use different approaches that exist in this family. Of course, we didn't use any reinforced learning. These are not really well adapted to what we want to do. We didn't consider unsupervised learning, but still in the other family, we kind of consider a lot of different models that exist. So let's go with the tree-based model. So all the tree-based models are based on this very small model that is a decision tree. In a decision tree, it's very simple. So each variable is just split into two regions or two categories. So either here being above 20 or below 20. And then we take another variable and we have another rule, which can be like -10 or below -10 or above -10. And then this goes on, and then we can decide either if we want to do a prediction or we want to continue the splitting. So this model for me is like kind of even easier to understand than a generalized linear model because we just need to read the tree and see where we're going and see what is the prediction. The problem with this model is that it's not very good to do some prediction because it's too simple. So what people have started to do is instead of having only one tree, why don't we have a forest of trees? So that's where the random forest model comes and also the gradient boosting model. And I don't want to go into the architecture of these models and the differences, but what you need to remember is just that these models are simply decision trees that we've put together. And then what we do is basically taking the mean prediction, for example, of all these trees. And we can have 1,000, 5,000, 10,000 of different trees. And that will increase our prediction success by having multiple trees instead of having only one. We can talk a little bit about the neural network models. So here I represented a multi-layer perceptron, and this is really inspired from the human brain. So it's really just our inputs here, our output here, and in the middle, what you see in blue are all neurons. And everything is fully connected. So all this first variable is connected to the first neurons, second neurons, etc. And all the neurons of the first layer are connected to the one of the second layer and the third, and etc. So that is just really like a way that we can learn data, and we see that, of course, like everything is going into all the neurons. So there's a lot of parameters. There's a very big architecture here. different hidden layer, different number of neurons. So this is kind of a very complex model, but it can get even more complex. If we go into the recurrent neural network, such as the long short-term memory, what's going on inside each of these neurons, it's derived by these equations. I'm not gonna tell you what it is, but what is important to know here is this idea of these models, they have memory. And that is very interesting. So we see the memory by this small index t here and t minus 1, which means that the model learns and remembers something that happened in the past. This is very good for text data. Like the ChatGPT model, they are based on these models because when you talk, you need to remember what you said in the couple of words before to know what's gonna be said in the next word. But if we think about environmental time series data, such as temperature or mortality, these models can be very good because if we know what happened during the early season in terms of air pollution or in terms of temperature, well, that's going to help us to model what's going to happen in the middle season. And same thing with the mortality data. So these models are very good for sequential data, such as time series or text data. And of course, we have our classical statistical model. So we can think of a linear model where the effect of one variable on y is just linear. We can think of additive, generalized additive model where the effect can be nonlinear. And then nonlinear effect, but at different lags. So considering, for example, the temperature 1 to 7 days prior to the observed mortality or morbidity. And then we have this lasso, which is simply like the generalized linear model in which we've performed automatic variable selection. So really the kind of model that we've selected for the studies are based on the performance on the y-axis that we expect based on the results we've seen in the literature, but also the complexity or inversely the interpretability of these models. So we see the statistical model being really in the bottom left of this figure. We see this decision tree that is kind of very simple, but not that much performance that is there. But when we go to the ensemble tree-based method, these models should perform better than the statistical model. And then on the top right, what we see is really the neural network model. So we're going to go into the core of the presentation now that you know a little bit more about machine learning models, which are the applications that we've done on these models to predict heat-related health impacts. So the first application is kind of simple. So we're just trying to model heat-related mortality in Montreal, and we're comparing different machine learning models to do so. So this is the region of Montreal. We use data from May to September because this is the heat surveillance period in Quebec. We try to model the all-cause mortality deviation, which means either the over or under mortality compared to what was expected in average for this day of year. We're using different predictors based on either temperature or perceived temperature, so the mean temperature, the relative humidity, and the wind speed. And also we incorporate the air pollution variables, so ozone, PM2.5, NO2, SO2, and CO. And also these predictors were all considered up to 7 days prior to the observed mortality. We consider the model I've just presented, so the statistical model, the tree-based model, and the neural network. And what we're really trying to do is predicting the daily all-cause mortality deviation using these predictors for this whole region. So the results we've obtained in terms of out-of-sample performance, which means data that were not used to train the model based on 3 criteria, which is the root mean square error, the mean absolute error, and the R-square. So we want all of these metrics to be the highest possible. When we see that there was kind of one model that outperformed the other, which was the GBM, so the gradient boosting model. So we're working with public health authorities of Quebec, and we said, oh, well, we have a good model here, so is that the end of the project, right? And they said, well, can we really believe that this model is going to do a good job when we are actually going to use it? So we said, okay, let's go see what are these different models doing based on the past 10 years of observation. So that's a very big figure, so sorry for that. But each line is one different model that we've trained. Each column is 1 year of data. And in black, it's the observed mortality data, while in yellow, it's the predicted values when we were in the training of the model, and in blue, it's in the validation phase. So these are all data that the models have never seen before. So if we look on the training in 2010, which was a year with a major heat wave that we can see by the mortality spike here, Well, we see clearly that there's some models that kind of really well represented this mortality spike, which was the decision tree, the random forest, the MLP, LSTM, and then GAM and DLNM. But this is in training, so it doesn't tell us how the model will perform when it's going to see new data, right? So we wanted to see how the model performed during the blue period, and we had this other extreme heat wave in 2018. So we looked and we see, there's only 3 models that perform kind of well and well predicted the spike of mortality during that heat wave. And it was the decision tree, the GAP, and the DLNM, which are kind of simpler model, and that's not something we were expecting. And one of our hypotheses here was that maybe the model didn't have enough data to train themselves on. So we only have 20 years of data. And then we said, we could go back 40 years before. But then people told us, well, data in 1880 is probably not representative of what's going on today. I said, well, just try it. So we trained the model on 40 years, and then now the 2 years are in validation. So either the 2010 heat wave or the 2018. So they're all in blue. And what we've seen is that, well, the model really improved their performance, even though these data were not seen in the training of the model. And we now see that the decision tree, the random forest, the light gradient boosting model well represented the spike of mortality here, again, GAM and DLNM. And for 2018, it was more the random forest, the gradient boosting model, and again, GAM and DLNM. So that was kind of surprising because when we showed the result for RMSE, MA, and R-square, well, the performance were saying that the GBM was always the best model, which we've seen here, but we also see other models kind of performing well. So the take-home message for this first application of machine learning for heat-related health impact is really that the choice of the model will depend how we evaluate the performance. So if we look at classical machine learning performance criteria, it's going to tell us to use some model, while when we look at validation during actual extreme heat event, it's going to tell us to use some other model. That's kind of something that is kind of new because people using machine learning model are very used to use these performance criteria and say when we have the best criteria, that's the model we're going to use. So we've published these results in Science of the Total Environment if you want to know more about other things that I haven't the time to show you today. So second application, we took again Montreal as an example, but we added the region of Quebec. And then we wanted here to focus not on the model themselves, but on the variables that we use in this model. Because in machine learning model, there's this philosophy of just throw everything in the model and it's going to improve your performance. And if we want to improve our heat surveillance or heat system, well, we need to think what's the variables we want to include in these systems. So we took Montreal and Quebec to do some regional comparison. We still want to model the all-cause mortality here. But what we've done for the predictor is we've built 17 different subsets of predictor. And these subsets were first based only on temperature indices. So that's like the classical model, only using mean temperature, maximum temperature, minimum temperature, or either the humidex, which is a combined index of humidity and temperature, or the dew point. So each of these 1 to 9 subset is just either, it's one of these 9 different indices. And then for the subset 10 to 7, it's combination of temperature variation, which can be like the change of temperature between different days, or the night temperature versus the day temperature, other weather variables, including atmospheric pressure, relative humidity, precipitation, etc. And then also the air pollution variables, to know if there's a synergic effect of air pollution and temperature during summer. So that's kind of the different subset of predictors that we tested. And we used, again, the same machine learning model that I've presented before, but just a subset of them based on their architecture. We know that GAM was pretty much similar to the GNM and to the DLNM. So we use GAM, random forest gradient boosting, and the 2 neural network model. So 5 model here times 17 subset of predictor times 2 region. That's a lot of model to train. And then a lot of results also. So I'm just going to show you the main result that we've obtained, comparing how the temperature indices perform versus the other subset of predictor that we have. So these are, again, out of sample performance results, so on data that models have never seen. And when we've looked at R-square or mean absolute error for the model with temperature only, we see that, well, performance are higher than for the subset with more predictor. So that's kind of surprising because, as I've said in the introduction, in machine learning model, we should be able to just throw everything in the model, and that's not going to affect the prediction. But here, in the context where the relationship between mortality and temperature is kind of small, so it's not a very strong relationship, well, adding extra predictor just models some noise in the data. So that's not a good thing. And we've seen the same thing for Quebec, only a slight increase, but that was not significant. So we don't see really that much of value of including more predictors in our model. So knowing that these models perform the best, which of these subset 1 to 9 is the best? So that's what we've seen here. So for Montreal, the temperature indices with the best performance were either maximum or mean value of temperature or humidex or dew point. While for Quebec, these metrics were more minimum temperature, so it's night temperature, off temperature, or humidex. And what we see clearly here is that the mean temperature is still doing a very good job, either for Montreal and Quebec. And we know that this metric is the most used metric to model heat and health relationship in internationally. So the last thing we wanted to see with this is what are the models actually that performs the best? Because all these results were aggregated across all of the models tested. So we looked at the models and we found that GAM, which is a statistical model, nonlinear statistical model, had kind of very good performance when it was used only with temperature indices. Of course, it doesn't mean that the machine learning model were not doing a good job. It's just that their performance were the same as the GAM. That was the case for Montreal, and that was also the case for Quebec. But then when we added extra predictors, well, the GAM was not having a very good performance on Montreal, but still a good performance on Quebec. So that's kind of interesting to see that when we have very few predictors, well, this statistical model can do a pretty good job to model heat-related health impact, mortality in this case. So the take-home message for this application is really that adding more complexity, so more variables or more complex model, will not always lead to better performance, and that's what we've seen here. And if you want to see the complete result, well, the study is already published in Environmental Science and Pollution Research. So we're going to go to the third and last application, and now we're going to kind of do everything that we can do, which is modeling both mortality and morbidity, and not focusing on either Montreal or Quebec, but trying to model these variables in all regions of Quebec. So we're working at the health region level. So there's 18 regions in Quebec. We're not using the 3 northernmost because there's very few people there. So less than 1% of Quebec's population. So we're using these 15 regions and trying to make prediction in these different regions using a machine or deep learning model. We're studying both the general population and also the 65 plus population, knowing that these people may be more affected by extreme heat. We're using either mortality or different morbidity outcomes, such as hospital admission, ED visits, ambulance transport, and health hotline calls. These are the same indicators that are currently being tracked by public health authorities during extreme heat events. So we're trying to model the same indicators as people are already aware of. And we're using, again, the same machine and deep learning model, except that instead of using a GAM, we use here a lasso because we have a lot of different predictors and we want to do some variable selection. So what variables are we using to make these predictions? Well, there's a bunch of different predictors, such as weather variables. So either temperature change, or humidity variables. We don't want to use other predictors such as precipitation or pressure because we know that these variables are easier to forecast. So if we are to use this model with weather forecast, it's going to be easier if we just stick to mean temperature, maximum temperature, minimum temperature, some humidex or dew point humidity variable, and change of temperature or diurnal change of temperature, which are only calculated from these 3 temperature and day. Then we have some regional predictor to incorporate what are different between these different regions. So some demographic variables, some socioeconomic variables, some built environment variables, and some climatological variables. And then we also included the temporal predictors inside the model, so daily variables, monthly variables, and yearly variables. So using these different predictors, we're trying to model either the daily or daily mortality or daily morbidity in all of these regions simultaneously. And the result that we've obtained, again, out of samples, so data that the models have never seen, in terms of R-square, well, we see here very clearly that the models with the best performance are either multi-layer perceptron and long short-term memory, and these two models belong to the family of the deep neural network model. So that's kind of encouraging because we have a lot of data, and we see that this more complex model leads to better performance. Of course, the gain in performance depends on the health outcome that we're looking at. But for example, for 811 call, we have 65% for these three models, and it goes to 82% for the deep neural network. Again, as in the first application, is that enough to say that we're going to use this model? Probably not. So we look at what the models were predicting during the 2018 heat wave. So in gray, it's the heat wave period. We look 3 days before, 3 days after. We have the mortality here, the hospitalization here, the ED visit, and the ambulance transport. This is in general population. We also have the result for the 65 plus population, but they show the same thing. And we have the different colored line here are the different prediction of the models. And what we see clearly is that most of the models did not predict that much of an increase in mortality during that heat wave. But there was one model that still did a pretty good job. Maybe the timing was not right, but still it showed that something was happening. And that was the light gradient boosting model in red. For hospitalization and ED visit, we don't see that much of an increase during the heat wave. And for ED visit, some model wanted maybe to have an increase, but we didn't see it in the observed data. And for ambulance transport, that was also highly affected by this heat wave. We see that the first spike was well modeled by the model in green and in red. So the green model is the multi-layer perceptron. But then for the second spike later on during that heat wave, well, we see that both models really underestimate what was happening. So again, some different results by what we've seen with performance metric and these partial validation based on what is actually happening during heat wave. So the last thing I wanted to show you here is what's going on in these models. So far I'm just showing you the result, and like we believe the models are good, but I wanted to show you like what's going on in the model. And again, they figure a lot of things, but then just look at the colors. So what color do you see being in the rank 1 to 15? The more we see a lot of gray, and the gray are all regional variables. So they're just variables that help us to understand the differences that we have between all these different regions. And then what we see a lot of blue, and the blue is the temporal variable. And we see that a lot for the hospitalization here, that day of week 6 and day of week 7, which are Saturday and Sunday. Well, there's a lot of trends in hospitalization data, so we see that the models are modeling that first. And then later on, what we see is a little bit of orange. And this orange is for the weather variables. So like the model, after modeling the regional difference, the temporal trends in the data, they start to model some of the weather effects. And we see clearly here that we have a lot of orange for the mortality variable, not that much orange for the hospitalization, not that much orange for the ED visit, and more orange here for the ambulance transport. So that's kind of aligned with what I've shown here, that the mortality was more affected by the heat and also ambulance transport. And something interesting is that our two neural network models, they don't really use the weather variables. They're just using temporal predictors. So that's kind of weird, like the way they learn the patterns is very different from, for example, random forest and light GBM models. So that is very hard to understand these models. That's the only thing I want to say here is it's really hard to understand what's going on in these multi-region complex model. So the take-home message for this is that, of course, we see maybe that machine learning, deep learning models are more promising here, but then it's very hard to understand what's going on. So we have very low explicability of these models. So if you want to know more about this application, it's been published in Sustainable Cities and Society. And that brings me to my conclusion. And as a conclusion, I wanted to turn it back to you and ask you this question. So after you've seen these three applications, like you compare statistical model, neural network model, and tree-based model. So if you were to work with public health authorities, what would be the model you would use and that you think is going to be the best one for them? And that is a very tricky question. People always ask me this question when I present, and I'm not sure if I have a good answer. So very curious to see what's going to be the answer. Okay, that's interesting already. So I was expecting to see the statistical models at first because, of course, we can see that these models are still working very good. But I was not that much expecting to see neural network being in the second place. Because if I go back to this example here, well, there was only one model that predicted well the mortality, and that model was not a neural network model. And the same thing happened also for ambulance transport. So for me, that's kind of clear that I don't want to use a neural network here, but still, maybe some people want to use them. So yeah, there's not that much of a good answer to that. I think these are all tools that you can use, and choosing the best tool is hard. But if I can leave you on some things, well, what we've seen is that from the first application, of course, the choice of the best model depends on how we evaluate the performance, and that kind of depends on what is your goal with this model. So the answer to the question I just asked is going to depend on what is the goal, what you want to do with this model, and how you will evaluate the performance of this model to achieve this precise goal. And then in the second application, we see that sometimes more complexity, more variables, more complex model is not always the best thing, especially for heat and health relationships that are not that strong. So that's another thing we need to consider, that maybe the complex model, such as deep neural network model, maybe not that good. And then the third application, a bit different than the second application, is that, yeah, these models can be good, but we're going to lose a lot of explicability with these models. So that's maybe something that your partner would like to have some explainability. So maybe that's something that's going to be harder. So we see clearly from the first two applications that machine learning model does not always outperform statistical models. So these are still good models. So don't think that if you're not doing machine learning model, you're not doing something that is good. And then from the three applications, well, of course, the choice of the model depends on so many different factors, such as the number of data you have, how you want to validate your model, how you want to assess the performance. So it's really going to be hard to choose the best model. And then from the three applications, also what we've seen is that these results in a lot of different ways can help improve surveillance of extreme heat, either if it's in developing new forecast model or understanding which variables can be used to develop new heat alert or heat threshold. So that's kind of about it for the presentation. I just wanted to let you know what's next with this project, or the next step for me. So right now, as Angela mentioned, I'm doing an internship with BCCDC, and we're again using machine learning model for heat and health, but in a different way. And what we're very looking at is which mitigation or risk or protective factor on the risk of dying during the 2021 heat dome. So it's a lot of machine learning model again, but just for something differently. And because we have a lot of different mitigation, we think machine learning model can really help here. And also I'm doing a lot of research on the heat-related economic impact, and also projecting these changes, these health impacts with climate change. So that's something else I'm also doing and trying to finish for my PhD. So we have one paper published and another one submitted for this part. So thank you a lot for listening. Thanks a lot for inviting me today to present you these results. And don't hesitate to write to me if you have any questions. I'll be glad to answer. Thank you.